Healthcare outside of Louisville's metro continues to grow as U of L announces a major expansion.
The Brown Cancer Center will now have a second location convenient to commuters who don't live in the city. It's all happening in Shepherdsville, right off I-65, where they will be adding the brand new building to their campus. Our Jose Alonso and chief photojournalist Philip Merrill explain why some are calling it a game changer for people who drive to Louisville now for their treatments.
Just within the first 2 months of this hospital opening, another major announcement on the expansion of healthcare and research that could benefit many Kentuckians that live south of Louisville.
I can tell you right now that it's our goal to reduce the cancer death rate in Kentucky by 50% within the next 10 years.
State legislators and U of L officials announcing the addition of health specialists in the area.
A new $25 million, let me say it again, $25 million center to advance cancer research, education, and access.
That funding coming from state legislators. In the audience was the public health director of the Bullitt County Health Department.
Kentucky's rate is about 170 to 175 per 100,000 people. While Bullitt County, our rates are around the state average. You get into more rural parts of the state and their cancer rates are much higher.
Part of that percentage is guest speaker Chris Sutton from West Kentucky.
When a seemingly innocent bump in my left cheek turned out to be a very rare form of malignant melanoma.
The Eddyville resident has been traveling 400 miles to and from Louisville for treatment.
I think it's about time for this type care to be, brought to rural areas. Boy, this is a great first step and so exciting.
He says this new center will benefit others like himself.
I'm not here for me. I'm here to get the word out and to help these people to talk about the patients who haven't even got a diagnosis yet.
The building will provide clinical trials, cancer screenings, and educational programs to people who live in southern, western, and central Kentucky.
So to go from no specialists, no oncologists, nothing in the cancer realm, to a center such as this, it's going to be cutting edge research and treatment. It's just a tremendous opportunity.
Bringing in convenient care to our rural neighbors. In Hillview, Jose Alonso, WHAS 11 on your side.
Well, the building will house infusion rooms, exam rooms, an oncology pharmacy, lecture hall, and much more.
U of L officials say they plan to break ground on the facility within the next year and that the project is set to be finished by early 2026.